out there. And at the same time, there are better, good paying jobs, more than ever before, waiting for a high school graduate if they want to go into the workforce before potentially pursuing higher education. So Everybody Counts is an initiative starting in Jefferson County where we're going to work to ensure that every senior in JCPS before graduation either has already determined where they're going to continue their higher education and has the scholarship dollars to do it, or is placed in a good paying job before they graduate. Now, we have a lot of people coming together with this bold statement and plan that every one of these young people have value, and we don't want to lose one single one of them. So today, certainly, Evolve 502 helping on the higher education side, as well as 4 great employers that have said they're willing to step up, hire as many of these graduating seniors as possible, and in the course of their employment, to provide all types of further opportunities to pursue higher education when that individual is ready. They are Ford Motor Company, UPS, GE Appliances, and Kroger. And in putting this together, community leadership is so important. So we were proud to be joined by Pastors Cosby and F. Bruce Williams today, great community partners, as well as the Urban League and so many others. This is a program that from inception to launch, we have moved very quickly. And it's one where, whether it's in Jefferson County or we work to expand this, talk to others in other counties, we are building the airplane while we are flying it, putting together the materials that aren't even compiled yet on what these multiple job opportunities are and what these scholarship opportunities are. But the reason that we're moving with such speed is we can't let one more class go by where we have youth that graduate that aren't ready to go on to higher education, and we just somehow hope that they find employers, and we hope that they find them in time. Because so many of our displaced youth struggle during that period of time if they're going to find an employer. So we believe that this can be a transformational program and concept that both moves us to where we need to go, having more Kentuckians with 2-year, 4-year degrees and certificates, as well as address significant openings in our workforce at a time where there are better pay and better benefits than ever before. In other words, just make sure every one of these kids, these young adults, has a path. They're all good paths right now. And more than ever before, you can pick a path and then also change it as you go. There's opportunities to go to college now or go to work now. There's opportunities to go to college now and work. There's an opportunity to go to work, planning on going to college with what each of these employers provides later on. It's just the idea of bringing together the largest employers and knowing their needs, but getting the commitment to each of those individuals and to their future, as well as groups that are out there working as hard as they can to better the education of our folks. We're really excited about this, and I tell you what, these kids today were excited about it. There was a lot that I expected moving into the announcement, but afterwards, almost every student that came individually came up to talk to me about how excited they were about knowing how many options were out there for them. I think that this is a real way where we can address numerous challenges in front of us and provide hope and opportunity for every student. And those in the lower grades are watching too, knowing that as long as they keep moving forward towards graduation, there is real opportunity for them. So stay tuned. We wanted to roll this out in concept and in program here first, especially because of the employer and other community groups that were there, but something certainly that can be replicated all across the Commonwealth, provide an opportunity for students at higher education and direct pipeline for employment as well. And with our economy where it is, $10.3 billion of new investment, and it's not quite Thanksgiving, though it's really close. Um, this is a time when we need to think differently, as ambitious as we can. You can't. That's what this program is. All right. Our COVID news is not either, though we don't necessarily think there's cause for alarm now. We got to watch this really carefully. First, COVID is taken off in Europe. Let's show the WHO. It is not only increasing significantly, it is increasing fast. Now, Europe is in a different place than we are in terms of percentages vaccinated in many places, how they've handled the booster, and others. But listen, this is a part of our world that we generally know fairly well that is starting to see a not just a significant uptick, but a surge in COVID cases. And in places with the lowest vaccination rates, it is really tragic. This next one is from Romania, one of the least vaccinated countries across Europe, and their bodies are piling up. I mean, they are piling up outside of morgues all across the country because of the speed of the surge and the number of deaths. What this ought to tell us is this pandemic isn't done with us. And our goal is to not be in this position, right? Is to have as many people vaccinated, and I'll talk about it in a minute, boosted as possible. Just because this is happening in Europe, well, first, it should cause us concern, but it doesn't mean it has to happen here. We have the tools to keep it from happening, to protect ourselves and one another. But as tired as we are of dealing with COVID, we can't pretend like it is not still with us. And as you'll see from the numbers from over the weekend, it's not just with us, but the numbers are not just creeping up, they are moving up at the moment. And what we don't know is if this is going to be kind of a new plateau that moves up and down, whether it's going to be more like a bouncing ball and the speed that it may go up and down in. Because as we look at the charts, each surge has been different, primarily because of the tools we've had to fight it, as well as the variant. So making it hard to predict when suddenly we don't just have vaccine, we have boosters against Delta. So as we look at Saturday's numbers, it's the highest Saturday in at least 4 weeks, 2,048 cases, 42 new deaths, including a 43-year-old woman from Ohio County. We look at Sunday's cases, highest Sunday in at least 4 weeks, 1,018 new cases, 15 new deaths, including a 43-year-old man from Davis County and a 36-year-old man from Jefferson County. So today's numbers, Monday's, highest in at least 4 weeks. There is a pattern here. 822 new cases, 44 new deaths, including a 49-year-old woman from Mercer County. Positivity rate as of today, 6.56%. So really an increase of about 1.5 points over the last 3 or so weeks. As we look at our stair-stepper chart, it does put into context where we are at the moment. We have the highest case number in 5 weeks. In other words, it's not just the 3 straight weeks of increasing cases, it's that we are now higher than 2 of the weeks of declining cases. So we're going to have to watch this very, very closely. Our testing has been fairly steady, so something real is happening. The question is now, when we look before at our plateaus, the increase and the decrease, not huge, but it was certainly significant at the time. What we're going to see now, and we'll have to watch with the tools that we have, we'll learn more in the next couple of weeks. If in the next couple of weeks we see, you probably have to leave this week off because we won't have a lot of reported cases. But if we see increases over the next 2 to 3 weeks, then we'll know we're possibly in another increase. But again, we have the tools to stop it. Test positivity. Again, 3 straight weeks of increasing test positivity. That is a leading indicator, though, the responsiveness of testing is now changing some of this a little bit. In other words, when there appears to be a lot of COVID, the number of tests go way up. And when it appears that there's a little less, the number of tests go way down. Well, that changes the denominator. And so it can lessen some of the meaning behind the data, the extrapolation that we can do from that chart. But ones that also suggest, in the very least, we're in a plateau, possibly in an increase. Hospitalizations are ticking up. We do not want to see that, and this corresponds with some other things that we are seeing. The requests for infusions for the monoclonal antibodies, the demand is going up, really across the Commonwealth. We still have enough right now. Though I think orders would have outstripped our supply last week, but we had it stored up from the opposite being the weeks before. Let's remember, monoclonal antibodies do not have an unlimited supply. If we had any type of surge like we did the last time, we would not have enough. And it's a lot better to get a couple of shots than to have an infusion. Chemotherapy is an infusion. The other thing I would point out is that the other forms of treatment are still a ways off, the new ones that you think about, the pills, and whether that's Pfizer's or others. Having a significant supply is still weeks, if not longer, away, and the supply will start very small. While hospitalizations are ticking up, really ICUs appear fairly stable, though remember they trail the hospitalization data by a little bit, and the ventilators also appear fairly steady. We have not been able to get a new average of hospitalization over the last 7 days because of reporting. Remember, that had gone down, and then it started to go back up. But I will say we are now below 30 hospitals in critical staffing shortages. I think it's 26. I'll confirm that in a moment. So, with cases going up, show the stair-stepper chart again if you can, just on cases, right? With the positivity rate going up, let's show that one too. And with hospitalizations going up, it ought to tell everybody that we need to be real careful on Thanksgiving this week, as well as Christmas coming up. But unlike last year, there's an opportunity for it to be safe, to really safe for you and your family. It's the first holiday, Thanksgiving, since the pandemic hit, that you have all the tools in front of you to have a pretty normal and safe Thanksgiving. So let's go over what they are. First, get vaccinated. Everybody in your Thanksgiving dinner should be vaccinated, as long as they are over 5. At least get them their first shot. The difference in safety between an entirely vaccinated group and one that not everybody is vaccinated in is going to be different, and it's going to be significant. If you have unvaccinated individuals at your Thanksgiving dinner, it's more likely that they can get it. It's more likely that they have it, and thus more likely to spread it. And with waning immunity, even if it's just a couple people that are unvaccinated, it presents a significant difference. Now, people are too young. If there are other medical reasons, that unvaccinated person should really consider masking because of the protection that it provides to everybody else and to themselves. So an unvaccinated person, especially that's for a medical reason that might also make them more susceptible, remember, waning immunity is real. So you should want to mask for yourself because a vaccinated person could have it. So, number one, if everybody's vaccinated for Thanksgiving dinner, you are the safest that you've been at a holiday since the beginning of the pandemic. But number two, get your booster. Get it before Thanksgiving. I hope you've had it now. If you can't get it before Thanksgiving, definitely get it before Christmas. If we can get your immunity back to where it was 2 weeks after you took the second shot of Pfizer or Moderna, then you are incredibly well protected against serious illness. You are, we believe, less likely to get and to spread the virus. So if you've been vaccinated, if you're over 18 and you have gotten boosted, and everybody is one of the two of those, if not both, you can have a really safe Thanksgiving. I'm pretty excited that my family will be there, everybody fully vaccinated, but my daughter, who is partially vaccinated, who will get the second shot right after with the 3 weeks that's there. All right, this is another big one. Just like work, if you are feeling sick, don't go to the holiday gathering. You know, we should all understand this one by now, but I know whether it's work and you think, I don't want to take a sick day, or whether it's, I would hate to miss the holidays. If you are sick, please don't show up to that holiday dinner and turn what could otherwise be safe into something tragic. Now, going back in time, I've been too sick once or twice, I can imagine in my life, to go to a Thanksgiving dinner. And I missed it, but the world went on, and I didn't pass what was, I think, the flu at the time to anybody else. And I wouldn't want them to have what I had that day. All right. If you are not vaccinated and or you haven't had the opportunity to get boosted and it's been a really long time, consider wearing a mask while indoors. It's for your safety. You are more likely to be able to contract the virus, to have a bad outcome from the virus, or to have the virus walking in. Again, nobody wants to look back at their Thanksgiving or Christmas gathering and realize that was when somebody got really sick who is no longer with us, right? So again, that's not to scare people. That's to say these are the tools where it can be safe. And last, there's a big difference if you have 10, 20 people over, and if you have 100. There is a big difference in numbers of how many people indoors closely together eating a lot in this occasion, and how safe that it is. So our goal here is to give you a checklist. You know, where we now are in this pandemic, and I get it, is we all have the information, and it's up to us to make the right decisions. But what I'm asking y'all is, don't get tired and don't make decisions based on being tired of doing the things that protect us. Here's a good checklist. Think through it all. Do as many of them as you can. But remember, if everybody's vaccinated, if everybody's boosted, you're pretty safe. And in that instance, it would be, as Dr. Fauci said, mask-free Thanksgiving dinner. So speaking of vaccines, since the opening of 5 to 11, something this parent is really happy about, we've definitely seen an uptick in the number of people getting vaccinated, and the weekends are actually pretty big. I was at a Norton clinic in West Louisville at a clinic this weekend. It was not only exciting to see how many kids were signed up, they were booked, but I actually caught some people coming out of the gym and convinced them to get their booster. They were ready. They just hadn't scheduled it yet. So over the weekend, and I love this, it's been a while since we've had some numbers like this, 19,555 Kentuckians getting their first shot of hope. To give you the top 5 counties, they shuffled around a little bit when we had to fix the reporting error. Fayette County, number 1 at 71% of all residents in Fayette County having at least one shot of hope. Woodford County, close behind, 70% of everybody who lives in Woodford County has had at least their first shot of hope. Jefferson County, breaking the top 3, 67% Jefferson County residents having at least one shot. Perry County and Eastern Kentucky, 4th at 65%. They've worked really hard at this. And Campbell County and Northern Kentucky at 65% as well. Let's break it down by age group and what we have seen. First of all, no change in the overall percentage of Kentuckians vaccinated, still sitting at 59. We're going to cross over that 60% threshold soon. Also, 5 and older, this is the all eligible. 63%, we're approaching 2/3. And again, if this were anything other than COVID and how deadly it is, we'd be really pleased at these numbers with this speed. Total 18 years and older, again, hadn't changed, but 71% of people who have their own control over their healthcare decisions have agreed that it is wise to get vaccinated, and our numbers are growing. In fact, you'll see that 3 of the demographics are over 18 that have increased. So let's go through them. 75 and older, still at 90%. It's the only time when I'll say 90 and above, isn't amazing, and that would be about the last thing I would say. This group is way too vulnerable to not have 100% or near 100% signed up. My worry is that everybody that we don't sign up in this group, we are at serious risk of losing. Next group, 65 to 74. These are our rock stars in terms of vaccinations, up a percentage point to 94%. That's really incredible. We want that group to keep going. And then I'd really ask folks in this group to talk to others, to talk to their family members. More than likely in this group, you may still have parents, and I hope you do, that are with us. And if they're in that 10%, help us get them vaccinated. But a lot of people in this age group have kids and grandkids. And as you'll see as we go down, you're hitting about the 2/3 or less than 50% threshold for all of those groups. So please have those conversations, maybe not over the Thanksgiving table, but maybe before or maybe after. 50 to 64, up a percentage point to 77%. Glad this is continuing to increase. 40 to 49 is the same at 67. 25 to 39, up a percentage point. We like to see that to 58%. 18 to 24, the same. 16 to 17 is the same. And I hope on these two, 12 to 15 and 16 to 17, I hope we're not seeing reduced demand. In other words, I hope we can continue to motivate more folks in this group to get their vaccine. And a 2% jump on 5 to 11-year-olds, now up to 8%. A long way to go, but we haven't had these available for much of this period of time for that age group. Booster shots. As we enter the holiday season, once again, you need to get your booster. So far, 504,028 Kentuckians, so 504,028 have gotten their booster shot. That gets them up to that high level of immunity. It makes their, hopefully smaller-ish family gatherings safer. So please, everybody, go get your booster. And to correct one statement earlier, 29 of 96 hospitals now reporting critical staffing shortages, lowest amount in a while. And this may be weekend reporting. I hope it's accurate that we have only 3 kids in the hospital at the moment, at least in the pediatric units, where there are only 3 of for the ICUs and 2 in the ICU. I'll know more about that tomorrow. We'll be able to update it on Thursday, but that would be good news. All right, we'll open it up to questions. We have 2 journalists that are here with us, about 6 on the line. So let's start with Mike from WLEX.
Representative Greg Guthrie is among the congressmen who have criticized the president's mandate to get vaccinated and also come back to get lethal testing. What would you say to the Kentucky congressional delegation amount of people who are pushing back on this?
Question is on what I think the presidential administration calls their vaccine mandate to large employers and or to federal contractors, which are separate programs, and some in Washington being against it, I guess some being for it. Well, the first thing I'd say is it's important that we know what it is and what it's not in forming those opinions. It is not a requirement that anyone get vaccinated. They call it that, and they hope that people will get vaccinated. What it is a testing requirement for those that are unvaccinated in employers that have over 100 people. And I think the rationale coming from Occupational Safety Health Administration is that if you have over 100 people in a workplace, there could be real spread if folks are unvaccinated, and that the testing would catch it. We desperately need to get more people vaccinated. I think that the intent here is that this would get more people vaccinated. It definitely comes with complications. The costs are significant. The preparation is significant. I've got a statewide workforce, so providing the opportunities across the state for people to get tested. And so I hope as people think through it, that they understand what it is and what it isn't. And there are certain areas where we already do it, which is like corrections and our behavioral health institutions. This would obviously broaden it. If we are required to do it by the federal government, we are taking the steps to be ready to do it. Tom?
Thank you, Governor. You mentioned Europe, and I think Austria and Greece are among the countries that basically shut down. They're on lockdown. Are you hearing anything that this is perhaps a new variant? Is it the Delta, a new version of Delta, or what are you hearing about that? And also the housekeeping thing, will you be having another press conference Wednesday?
We will not be having a press conference Wednesday. This will be our last of this week. I figured Thursday, y'all were probably busy. I have not received information about a new variant in Europe, though I will check after this. What I can say from our national calls and from our analysis, our genomic sequencing here in Kentucky is everything is Delta. And I know that's an oversimplification, but the numbers nationwide, but especially in Kentucky, is that everything is Delta. And my hope is that maybe Delta is the most severe thing that we see, but we still don't know really how severe Delta is, right? Reinfection, we haven't seen Delta versus Delta, if you will. Somebody who has had Delta, how long with it being more aggressive? Might they have some amount of natural immunity, and how long would it last? What we do think we know from the numbers is that someone vaccinated and boosted are about as protected from Delta as they originally were to Alpha when they got vaccinated originally. Europe's getting hit really hard, and that ought to tell us just to be careful. And we have more readily accessible tools than they do. Certainly all of our people that see it going on and saying, oh my goodness, I don't want to go through this again, and I've lost too many people, you can go get vaccinated right now. And if everybody would go get vaccinated right now, we'd be done in the United States other than boosters. Sarah Ladd from the Courier-Journal.
Yes, thank you. I've got a question here from a colleague. On the Build Back Better bill that passed the House Friday, you said Saturday some sub pieces are in it you wanted to see discussed to make sure we get right for all of Kentucky. What parts of the bill were you referring to, and do you share some of the concerns about the bill that have been raised by Senators Manchin and Sinema? Thank you so much.
I think the concerns that have been raised by those two senators are ones of inflation. I believe that our inflation is being primarily driven by the supply chain and not spending in the economy. And if it's spending in the economy, I think that it's everybody being excited to spend their own dollars and not reliant necessarily on federal spending. I think we also get confused at the timing of the spending. Like you see the infrastructure bill and it's billions of dollars. It's over 5+ years, and it includes in that amount that they tell you the amount we normally get each year. So for instance, in our roads and bridges, in our road fund, I think it's about $170 million extra a year. It's not billions upon that. On the Build Back Better bill, on some of its pieces, it's great that we will have funding. The challenge of building out, say, the child care infrastructure is a real challenge that takes time. I mean, we already have hundreds of millions of dollars in federal funds ready and dedicated to it, but you got to recruit in and train and get the facilities and other places open. So, I think it's a myth that all this money immediately floods into the economy and would cause inflation. I think that there are some things that we want to get right within it. I haven't seen any of the tax issues, what made it in and what didn't. There was one portion that would have hit Hopkinsville pretty badly and was written in a way that would impact almost only Kentucky and not anywhere else in the country. And that was a portion of the tobacco tax hike. I believe most of that is out. I think we got to get the electric vehicle tax credits right in a way that will achieve the ultimate goals about ensuring we continue on this path and ultimately addressing the environmental pollution from vehicles. So those are just a couple, but I will admit, with everything going on, I've not been able to sit down and read every part of that bill. I support its general premise that now is a time to invest, especially in the support structures that can ensure that families that are lucky enough to be two-parent families, that both parents can work, that structure is in place if they so choose, such as childcare and a number of the other pieces of the bill. I think will do good things for us. Melissa Patrick, Kentucky Health News.
Hi, Governor. A Wall Street Journal article analyzes a couple groups of data that basically says breakthrough cases are most prevalent among people with underlying conditions or who are older than 65. And so that obviously indicates the vaccines are working for most of us. But I'm curious, are you keeping any stats on the number of breakthrough cases broken down by the percent of people who are vaccinated, and then breaking it on further down for hospitalizations and deaths? And if you have them, is it something that could be added to the dashboard?
So, and I want to come back to the starting part. Thank you, Melissa. So what we have is the chart that we normally put up, right? About what percentage of cases are fully vaccinated people, what percentage of hospitalizations, and what percentages of deaths. I don't know. I have not seen a further breakdown than that. And if we're not doing it, I'd have to see the amount of work that may or may not be required to pull that data out and what it would pull other people off of. But let me check on that. Now, breakthrough cases on the federal side they're not tracking just I tested positive or I didn't. I mean, the way they do breakthrough cases really is, are you sick? And so I think when we understand that's what they're tracking, a person who is vaccinated, who is not only positive but sick, that's when it really makes sense that it would be people with underlying conditions or who are older who are more likely to get sick if they get it breakthrough or not. And so I think it absolutely shows the vaccines are working. The other challenge is the vaccines may work so well that someone who is not in that age group, that is not immunocompromised in any way, may never know that they are positive. Certainly, we talk to people every single day that don't fall in those groups, that get a breakthrough case, and it's either minor symptoms or they get a little sick, but they realize how sick they would have otherwise been. So I think that's a great point to get vaccinated, and we'll see what type of breakdown we have. Certainly, if we're doing it right now, we want to provide it. Corinne Boyer, WEKU.
Hi, Governor. I also have a question about the dashboard. Under the hospital stats, the ICU capacity in use for most regions ranges from like 86% all the way up to 95% capacity. It just seems like those numbers have been that high for a long time. So does that mean that those hospitals really haven't seen that much of a decrease in their ICUs, and are they still struggling?
So everybody across the board has seen generally a decrease in their ICUs. Remember, it got so bad they were creating new ICUs. And what happened is the hospitals with large, sophisticated ICUs got fully overwhelmed, and then you couldn't transport folks. So right now, we are not at the place we were in ICUs, and we do have capacity. Now, just having a bed in an ICU for purposes of COVID, an available ICU bed, it requires that we have the staffing to do it. which is and remains a major challenge. However, we saw two very effective things, and I've talked to 3 hospital heads just in the past 2 days. The guard coming in, even not doing the clinical part, freed up a ton of staff. And then the nursing students get high grades, especially from certain institutions. So no, we are better on the ICU side, but if we go into another surge, it could get bad pretty quickly, and it doesn't happen all at once. Anita Wise from WLKY. Okay, I don't hear anything coming through. April Rickard from WFPL.
Thank you, Governor. I was wondering what kind of response there's been to the boosters being open to all adults, and also how many kids in the 5 to 11 group have had their first shot?
So I believe that the response has been good since it opened up. Now, just because we open it up on a policy level doesn't mean it doesn't take a little bit of time, especially for large national organizations that are in multiple states to open up. Certainly, health department's ready, following the executive order, and then the federal government. I believe we're waiting. Either they have gone ahead and approved. I know that the FDA did. CDC given final approval to that. If not, we expect it in days. We believe that people are excited about it, and what we're seeing in Europe right now is they wish they did what we are doing right now, going ahead and getting everybody boosted. Let's see, on the new age group, 5 to 11, we have total 32,774 Kentucky kids in that area that have gotten vaccinated. I would need to get the Delta from the last report to tell you how many we got over the weekends. If you get there before I do, if you pull Friday's report and compare it to today, it would be that difference. I would expect that a significant portion of the 19,555 over the weekend are in that age group, because looking at the 12 to 17-year-olds, they don't make up a significant portion during that period. We have that part pulled out. We don't yet have a daily 5 to 11 tracker just yet. Austin Horn, now with the Lexington Herald Leader.
Thank you, Governor. Got another infrastructure bill question for you. I'm wondering if you have any updates regarding your administration's key priorities, aside from the big name projects like the Mountain Parkway, Brent Spence, and I-69. Mm-hmm. And I'm also curious if you think the Republicans in the legislature will have any materially different priorities than your administration for the money, or if you expect your proposals to get bipartisan support.
So when we look at that question, if I can actually add a wrinkle to it, Austin, you got the infrastructure bill money, and we have the ARPA money. And ARPA money has gone to infrastructure in the last round, and some will probably do so here. Most of the money flowing from the infrastructure bill goes into existing programs we have, like it'll increase the road fund for roads and bridges. And then other pieces will be new, likely to go through the infrastructure authority, but they're programmed out, like the water sewer money, $600+ million. Those are low interest loans. Those are not grants like we were able to do with ARPA. Certainly with ARPA, I think we need to sit down, and we will have to reach at least some bipartisan consensus because of how a program would be administered. Certainly, you could think a legislature could go alone on what to do, but then we got to effectuate it. So all of us sitting down and getting a good idea where we want to go on that is important. I think what you'll see, the discussion on the infrastructure dollars will be a lot how to structure the program, where there will then be applications to. And then on the roads and bridges money, it's what do you potentially move up in the road plan, that if we hadn't gotten the extra, about 170 million in roads and bridges would be 2 years out and 4 years out or further. So I think we'll have good discussions there. And there are a lot of needs, and they stretch across so many different areas. I would like to see on the safety dollars, continuing to look at school safety, not having turn lanes into schools. And we came out of one today can really lead to not only accidents, but severe congestion. And so looking at where the safety dollars can be used the best. We'll be using some analytics to determine that. When we did the discretionary school safety dollars, we actually overlaid traffic accident frequency and congestion over all of our schools, and we could see the points where analytically we could show we're suffering the most. We look forward to doing something similar this time around. And that's a good problem to have. And even discussions with the legislature, these are all where we invest. And so, just like a good job, a good road or a good bridge in red or blue, it's just good for our families. And I hope we spend the money where it's most needed. All right. Thank you all for joining us today. I believe our next update is going to be next Thursday, not this coming Thursday, but thereafter. Next Monday is kind of a big day for me, and I'm going to spend that part of the day with my kids. I think they're going to make a cake, and I am sure it will be good. Thank you all.
Oh, it's your birthday?